The Greater Cleveland Food Bank is the largest hunger relief organization in Northeast Ohio. So we serve 6 counties in the northeast portion of the state. The largest county that we serve is Cuyahoga County, which is where the city of Cleveland sits. We opened last November 2023 a community resource center. So we built a new partner distribution hub in 2022 that allowed us to use space that was our former food bank to create a space for people to come together, access resources. And then under the roof of that building, we have 15 nonprofits who are providing services in all types of areas. One dedicated specifically to working with older adults. We have 5 that are dedicated to workforce development, including our community college for continuing education. Upskilling happens. And then in addition to the 15 nonprofits, we also have over 40 other nonprofits that come in to spend time in the lobby just to provide additional services, cost savings, things like that to anyone in the community who wants to come in to see what they might be eligible for and who they can connect with. The primary way that we receive referrals through Unite Us is through the healthcare systems that are in Cleveland, Ohio. So there's 3 major hospital systems: the Cleveland Clinic, University Hospitals, and Metro Health. Metro Health is the safety net hospital, and they actually have an FQHC health clinic in our building alongside with us. So as people are coming in for healthcare services, they're being screened by maybe a dietitian or a social worker or whatever level of practitioner is doing the screening with them to see if they're food secure and what their overall social determinants of health are looking like. If they do need food assistance, then those healthcare providers are sending referrals to us, to our organization, and then we're able to make calls out to the people who are in need of food resources and have a really robust conversation with them, not only about food, but about what other resources that we can connect them with because we're all together in the building. So I think for us, we've been able to reach so many more people now because we have all of these representatives through Unite Us, being the healthcare partners, who are sort of doing all of these screenings and referrals. So it's just made our reach expand. I think before we were receiving about 3 phone calls a month from people who were connected to us through healthcare partners. And now we're at about, 400 or 500 referrals a month. So yeah, I can't do the math on that, but I mean, it has expanded the work tremendously in the amount of people we're able to reach. It's funny because when you're hearing about the technology for the first time, it kind of seems like it's going to be impersonal, where you're just going to send a referral off into cyberspace or something like that. But really what has happened for us is the exact opposite. It's made things really more intimate and intentional because as new healthcare providers join Unite Us, it gives us an opportunity to come together with them to learn about the patients that they're seeing and for them to hear about all of the resources that we can offer and really learn about what that referral means and what's going to happen behind the referral, instead of just kind of seeing it on a screen in front of you and, okay, this name of this person is going to this organization. You really know what that organization stands for, what it means, and the full breadth of what is going to happen. So the healthcare providers oftentimes are able to prepare that person for it in their conversation. These are the things that will be offered to you. And then for us, it's lovely because that person is prepared. They're, anticipating the phone call. And then we're able to just kind of, take the referral and run. But then we're also able to go back to some of those providers and say, hey, that is not something that's in our scope. Maybe let's find someone else for you to send that referral to. So it's really actually made our connections so much closer, which is, like I said, the exact opposite of what we thought was going to happen with the technology being behind the work. It's huge. I mean, it saves really just from having uncomfortable conversations with people, going in unprepared and not understanding really where they are and if they're, working their way through a traumatic situation or like an emergency situation or something like that. But not only that, we have that better level of understanding of what maybe that person needs, but we also, before we reach out to that person, can get those supports ready and on notice. So, if someone has, suffered a house fire or something, then we can be coordinating efforts before we ever even get in touch with that person to make sure that once we have the conversation, we're really ready to go and provide all of those things. 3 years ago, we received a referral from a doctor's office for a woman who had her newly adult, 18-year-old daughter living with her. And she was working full time, but she was underemployed. She was only making like $10 an hour or something like that. Had always been a full-time worker in the workforce, not one of those, go get a job kind of things. Like, she had a job. She was trying her hardest. Her daughter was living with her, and she screened as food insecure. So they sent the referral to us. And one of our team members called her and, kind of was talking with her about the options. With her daughter being in the house, they really didn't qualify for much because it was a 2-person household. But when she explained that her daughter would soon be leaving for college, the person on our team said, well, once you're a single person household, you're going to qualify for a lot of things. So in the meantime, she helped her connect to an organization that got her a new stove, because that was like a major priority in her food insecurity thing, was that she didn't have somewhere to be preparing, food. So she helped her make that connection. And then she said, call us back when your daughter leaves for college, and we'll immediately be able to, connect you with SNAP benefits and Medicaid and things like that you'll qualify for. So she did. And the person had, by this point, kind of developed the relationship with her and things like that. And when they got on the phone again, we were hiring for a bilingual help coordinator in our help center. So we have a help center that's a call center where people can call in to get help. All of the same things we would do in person, we do over the phone as well. So we were looking for someone bilingual. This person was bilingual in English and Spanish, which was what we were looking for, and also was working in a call center, the call center where she was making $10 an hour. So our representatives said, we have an opportunity right now at the food bank that we are looking to fill. It would be great if you applied. Well, she was hired. She's been with us for more than 2 years now. She's already been promoted once. She's working now in advocacy and specifically teaching our neighbors and the people that we serve how to advocate for themselves at the local, state, and national level. She's leading a group of advocates and doing really, training with them so that their voices can be heard. And I think, her lived experience, the fact that she came through us, to us through Unite Us, and the fact that our team member was so persistent in offering help. And, sort of one of the mottos of our team is, it does not matter what that person remembers that you've told them about resources. All that matters is that they feel connected to you so that they will call back. If they don't remember anything else, they need to remember that you are a helper. And I think that point made it across to her in their initial conversation that I am here to help, and I really mean that sincerely. And she followed through on her end with making the phone call, however many months later. And we followed through on our promise to do anything that we could. We don't stop at food, right? Even if it means employment within the food bank, that's what can happen. So I think just a story about really, the intimate connection that happens, and the way that our team really pays attention to details of what's happening in a person's life and who they are as a whole person, to see what can come of it. It could be employment, it could be food, it could be anything that can come out of that conversation.